What if AI could help detect a bladder stone before severe pain, blocked urine flow, or complications begin? Bladder stones are hard mineral lumps that can develop in the bladder, often when the bladder does not empty completely. Over time, leftover urine can allow minerals to collect and harden into stones. This can happen in people with bladder outlet blockage, enlarged prostate, nerve-related bladder problems, or chronic constipation. Many people ignore the early signs, but the body often gives warnings first. These may include pain or burning while urinating, frequent urination, and difficulty passing urine. Other signs include lower tummy pain, cloudy or dark urine, and blood in the urine. In some cases, the symptoms may look similar to a urinary infection, which is why proper testing matters. Doctors usually diagnose bladder stones through urine tests, blood tests, and scans such as ultrasound or CT. Sometimes a cystoscopy is also used, where a thin camera is passed into the bladder to see the stone directly. Now, where does AI come in? AI can be useful in reading imaging and identifying subtle patterns. It helps doctors organize symptom data more quickly and identifies patterns in reports. AI may assist earlier recognition by flagging suspicious findings on scans or connecting repeated urinary complaints. But it is important to say this clearly: AI does not replace medical examination. A real diagnosis still depends on a healthcare professional. This is a support tool, not a final decision maker. Evidence is growing for AI-assisted urology support, but claims should stay realistic. Treatment depends on the size and cause. Small bladder stones may pass, but larger ones usually need removal. A common procedure is cystolitholepaxy, using a thin instrument to locate, break up, and flush out the stone. Treating the underlying cause is also important, or the stones may come back. The real message is this: AI may help doctors notice the warning signs earlier, but you must listen to your body too. If you have fever or cannot pass urine properly, do not delay. These should be treated urgently. The future of medicine is not only treatment, it is earlier warning, and early warning makes a big difference. To stay ahead of the future of health and AI, please subscribe and join our journey.